Hi, and welcome back to my channel. Have you been to Mexico? I have. Are you thinking about it? I am. I'm thinking about moving there. But there are certain things that a person my age must consider before picking up and moving to another country. Number one on my list is healthcare. And I'm here to talk to you today about some of the things that I happen to have witnessed and some I have learned about. And that would be where to find medical attention in a foreign country, Mexico. My experience is that the larger cities, Cabo San Lucas, Puerto Vallarta, Zihuatanejo, they have large hospitals. And they're run pretty much just like those hospitals here in the United States. The smaller cities don't have the large hospitals, but they do have medical clinics. And they are what you might think as a stepping stone if your situation is so serious that you may need immediate attention and then be transported to a larger hospital in a larger city. That's an individual thing, okay, and only you can decide that at the time your situation may or may not occur. I'm not normally prepared, but as I'm aging, I am learning to be. So, for example, I've told myself when I get down to Cabo this time, I am going to go to the hospital. I'm going to find the front door. I'm going to look around inside. I'm going to see where you register. I'm going to see where there might be an entrance to the emergency ward, just in case, you know. I always seem to have an emergency when I do, which is not too often, but it'll be at 2 or 3 o'clock in the morning. And I'd like to know where I'm going, especially in a new city. So that covers hospitals and clinics. The next thing on my list that I want to share is pharmacies, pharmacias in Mexico. They're quite interesting, actually. Number one, you don't really need prescriptions written by a doctor to get what you need. But what I do recommend is that you take a list of your pharmaceuticals that you're presently taking, obviously, and take it with you. And you might walk in there, introduce yourself, not introduce yourself, ask the pharmacist if they've got these. Are they readily available? How much are they? Just to keep your finger on the button. The other thing is interesting about pharmacies in Mexico is a number of them have doctors on staff, which are basically stationed there in the pharmacy pretty much 5 days a week. And they can treat minor ailments, for example, a sore throat, an earache, or maybe a scrape here and there, whatever. But I understand that the fee for that is nominal at best. So that's something that we're worth looking into. So with that being said, I wish you good travels, safe travels, healthy travels. And the only other thing that I can think of that's as important as a hospital or an emergency ward, where do you find a good fish taco?